Welcome back. Okay, we're gonna go there. Be honest, how often have you gone to the bathroom and sat on the toilet way longer than you needed to? You know, just scrolling your phone, avoiding your kids.
Maybe you were distracted, or maybe you just needed a little bit of a break. We have Dr. Coley here, who is really going to explain, there's a lot. We're not just talking about something that's kind of maybe funny and awkward to talk about, but there's some health benefits and some science behind this too.
A lot of science, ladies. So, if you think about it, it might be reasonable to think the longer you sit, the better it is, right? Because you're giving your bowels time to empty and you're relaxed, but it's actually the opposite. So most experts say don't sit longer than 5 to 10 minutes. Because think about what's happening when you're sitting. Your thighs are supported, but your rectum, is actually opened up and gravity is pulling it down. So your risk for hemorrhoids, which are these swollen veins around the rectum, can go up. And for women, especially postmenopausal women, you can get a lot of weakening of the pelvic floor because your pelvic floor is kind of holding all your organs up. So the longer you sit, the more you can put yourself at risk, basically.
And you're talking about personal bathrooms, like when I'm like, okay, kids, mommy needs some me time, and then I'm just scrolling on Instagram. But who's higher at risk? Is it men, women? Does it depend on the age group?
Yeah, so as you get older, your pelvic floor relaxes. That's where those Kegels come in that really help to kind of keep things tucked in. So women, especially postmenopausal women, anyone who's chronically constipated is at higher risk, because you can imagine you might be straining. And if you're scrolling on your phone or Instagram or what have you, which is a common behavior, many people use the toilet as the me time, right?
Yes.
That's a time when the world is shut out, you're just sitting there, and 5 minutes can turn into 10, into 20. That can actually increase risk, because the longer you sit, the less supported your organs are, and everything's going to kind of bulge out. So the idea here is that after 10 minutes, if you haven't gone and you need to set a timer, then you get up and you walk around, or you do something else.
Okay.
Because walking around actually stimulates your gut, makes you move, or you eat something, because there's a reflex called the gastrocolic reflex. So for many people, when they wake up in the morning, the coffee or the tea or breakfast is what helps them move their bowels in the morning. So that's what you would want to do naturally. Don't just sit there doom scrolling Instagram at all.
Is there a certain time that someone should consult with a doctor? Like, what are some of the other signs they should be looking for?
Yeah, so I think it's really important to keep that phone and tablet away. If you are going to bring it, set the timer. But if you're feeling like you're having to sit really long time to move your bowels, you're having trouble moving your bowels, they usually say about 3 weeks of chronic constipation. That's a time to talk to.
3 weeks, that seems very uncomfortable.
It's very long, but I don't mean completely not going. That's obstipation. I mean just not going normally. Now, the other thing to be really mindful of is, what is your normal? And this is really important, because for some people, normal's every day for most people, but for some people it can be a few times a week. And then looking at the caliber of the stool. And so we took my nephew to the gastroenterologist, the GI doctor, and they have a little stool chart, and you should really be having sort of a sausage every day for most people. If you're starting to have pellets, you're probably getting behind and getting constipated, and that puts excess stress on your rectum as well when you're trying to move your bowels.
Are there any sort of things that we should be eating to help with this?
Yeah, so natural things definitely help. In fact, our body's designed to have this system in place. So taking laxatives is a terrible idea. If you need to take it once in a while because you took medicines or traveled and fell off your schedule, that's fine. But on a regular basis, the fiber, making sure you stay hydrated, because that water is what keeps that stool nice and soft, makes it easier to move. And then supplements that can help, like magnesium, for example, can help keep your stool nice and soft. So for a lot of my patients that fall behind, I recommend a lot of these natural remedies rather than any of those stimulant laxatives or any other types of laxatives. And again, if it's been a few days, it's important to talk to your doctor.
And you and I talked about magnesium earlier. I mean, this is a little bit of a sidebar, but magnesium, you said, also can help with anxiety, with sleep.
I take it myself. I tell a lot of my patients, in fact, it even helps with arrhythmias. There's a certain type of cardiac arrhythmia that it can help sort of settle out. So for most people, it's safe to take magnesium if you don't have kidney problems and you're healthy. And I usually recommend it at bedtime, because it's a nice way to sort of wind down. When you're moving your bowels, ladies, I also recommend try to do it around the same time every day, because there's something behavioral about it as well with your brain. So sometimes people just get up and start running out the door first thing in the morning and then try to go at work in between meetings or what have you. That's not the right way to do it. You really want to program your body, because it's just as much behavioral as it is sort of physiologic and scientific. And if that iPhone helps you relax, Sam, then you can have it.
Noted.
But you have to set a timer for 5 minutes.
Got it. Thank you, Dr. Coley. Always great advice.
Thank you so much.